Upexa, thank you very much for joining our podcast. For the listeners that don't know who you are, please tell us who you are and what you do.
So I am the Associate Director of People for Solihull Hospital and Community Services. And I've been here since February 2024, so just coming up to a year and a half.
Okay. Tell us a little bit about where you came from and what you did before.
Yeah, so I'm not from an NHS or a healthcare background, sector background, and I think I was probably recruited for that particular reason to bring a different perspective. My background there's quite a variety. I've come from private organisations, done utilities, railway, and my last employer was higher education, a university sector where I spent 7 years. So I've got various amount of experience within different types of organisations.
So you bring a lot of different expertise into this role, I guess, from what
Uh,
you've been historically.
yeah, and I think through my career, I've built up my portfolio. My background was around employee relations. But with that, and employee relations comes with the what people perceive as the negative matters. But as I've grown through the journey, through my own career journey, I've realised that I actually want to add value and make a difference, and to break that cycle of poor employee relations. I've looked at the people experience journey and what that would look like, and seeing it from people's perspective, and as a staff member myself, and so exploring all of those elements that make people feel at home, because we spend a lot of time at work, but also think about what are the things that make people feel rewarded for what they do, understanding actually the motivation for being there, and all sorts of other things, because it's not just one thing that will be something that holds someone in an organisation. It'll be a variety of reasons, and everyone's very different with that. So it's trying to touch upon that, although the outcome is always around. So in this organisation, it's about patients. In my last organisation, it was about students. And organisations tend to have a real focus on the end product, and then we forget the people behind it, but they're really pinnacle to that journey, and getting those best outcomes. And so my job is to ensure that we get the best of our people to deliver those best outcomes for patients here.
I love how you said that there's layers to that. It's not just one single lens that we can look at someone at. There's various different ways to deal with that. So I really like that. You said you've been here just 1 year now, is that right?
Nearly 18 months.
Nearly 18 months, sorry. Nearly 18 months. Tell me a little bit about that journey then, from when you first started. What was Solihull like, and how have you seen that change over the last few months?
Yeah, so I guess it's not just about Solihull. I've learned a lot about UHB, but Solihull particularly, I suppose. I had to I had to use a lot of time right at the beginning to really gather my insights, because I knew very little about the healthcare sector, to understand that the different departments, and we'll call them specialties here, how they operate, and they're all very different in their own right. What people's behaviours are like, the culture is like, and I'm not talking about poor behaviours necessarily, but how they behave depending on the type of role that they do, the different staffing groups, and how they all work together with one another. So there's a whole aspect of things here. And one of the things that I've always been conscious about, so having understand UHB as a whole trust, and then the different hospitals and their demographics, is all around Solihull being different to places like Heartlands and QE, purely because of the setting just outside our hospital. With, if I talk about race or the demographics, it's predominantly white, and actually looking at the makeup of our own workforce and how we could look to increase that diversity. And I guess one of the biggest opportunities here when I came, which was already here, was the recruitment for the elective hub.
Yeah, I was just going to ask you about that. Yeah, please tell us a bit about that.
Massive opportunity here. So it was already set up. We knew that the money was there. We were going to go on this journey of recruitment. And what was important was around the having local jobs for local people. But where the concern comes in is that when you're a demographic outside the site or the community services, is predominantly white. How are you going to do that?
Yeah.
And so you have to look a little bit further afield, or be very creative of how you do that, whether that's looking internally and across the trust. There is definitely diversity, but also looking further afield, so like international recruitment. And my understanding is that we didn't have lots of international recruits here at Solihull, and that's really come on the journey, because I think we've had one of the biggest international cohorts Solihull's ever seen, and that brings different perceptions, different experiences, and gives us a wide range of opportunities, and to start thinking differently as people, as opposed to thinking about how it works here in Solihull, but taking on other people's knowledge and skills and experience and perceptions.
How's that look like then? Being very like, you've seen that transition, you've seen that elective hub, you've seen the mass recruitment that's happened. Outside, how does it look like now then, would you say?
Yeah, so I know that the demographics have definitely changed for the positive. It's heading in the right direction, but we've been able to speak to people on the ground who have started, and they only opened it was late October, beginning of November. But for those international recruits particularly, or people that may be from international, but this is like their second job here in the UK, there was an interview done with some of those staff to understand their experiences, and you can tell how important their onboarding induction was, but the impact that it had by having a really good one. But there is something about understanding and having an awareness of different cultures, and that having a different cohort come in, a diverse culture come in, has given us that opportunity to learn more about one another, and not just saying this is the way that we do it and this is how you're going to have to conform. We're not doing that here. We're trying to learn from one another. And yes, there are ground rules around things. We're in the medical field, and that's fine in healthcare, but there are things that we can still learn from each other. So it could be the littlest things about gestures, and just having an awareness of it, or the way that somebody speaks. And actually it's just having an understanding what is behind some of that, and having an appreciation. Or if someone doesn't give you direct eye contact, there's something behind that as well.
The cultural nuances that
absolutely
really. And I think that's what's been great about this international recruit, because we're getting to learn about these different cultures, different people are learning, and it's creating this inclusive environment. One thing I really love that Solihull are doing at the moment is this world map. You say we're not inclusive here, but please tell us about this world map and how many different countries are on this map.
Yeah, I'm really excited about that, and I was excited to see the data. So we've created a world map to indicate how many countries we represent here in Solihull, and how many of those people come from across the world. And we represent 59 countries across the world, which is phenomenal.
59, that is phenomenal.
Yeah, and I am pretty sure that we were nowhere near that before the elective hub recruitment. So, since last year, we've really come a long way. But that just shows the absolute diversity, but the opportunities that brings for Solihull.
I mean, what a way to celebrate, who we are and what we stand for. And when that goes up and it's visual, I think it's going to be incredible. I think all the other trusts need to come and have a look at that world map.
We can add to it.
It's going to keep adding to it. Absolutely. I'm really excited to see that. Just before we wrap up, then, if there's one thing that you want to say to anyone listening, either from an inclusion point of view, diversity, whatever it is, there's one thing that you want to leave a message to our listeners to, what would that message be?
Yeah, it would be about, come and share your stories. There is a SLT here, there's SMT, there are managers, leaders, there's all colleagues. I believe we all want to hear the stories. We want to hear the differing perceptions. I myself am from a different background, but I was born in this country, but I do come with different perceptions because my parents weren't. And so that I have some level of understanding, but I'll never have the full understanding, and I don't expect anybody to have that. That actually don't feel that you can't, or it's not going to be valued, because I genuinely believe any idea has value in it, and it's worth hearing and listening to and scoping out. Or if there is an idea, you can scope it out further with the support of other colleagues. You don't need to do it in isolation, but be forthcoming and share. And if you believe that a colleague doesn't have a full understanding, don't be shy about it. Feel confident to have that conversation and work through it. Because I think we're on a journey of trying to understand one another, and I think it's really important that we continue to do that.
I love that. We're on a journey and we need to share our stories. Upexa, thank you so much for being on the podcast today. It's been a pleasure speaking to you.
Thank you.
Thank you.